want to thank our witnesses for all your work during a very, very difficult time. And we're here talking about reauthorization of the Pandemic and All Hazards Preparedness Act. But I just want to state, not in the form of a question, but the juxtaposition of an act taken by the House Republicans last week that would result in drastic cuts to our public health programs and our research initiatives, and cuts that would undermine our nation's competitiveness as well as our safety, our public health, and our security, and leave us completely unprepared for the next public health emergency. And I certainly stand with many of my colleagues who've voiced concern about that in opposing the measure that the House Republicans passed last week. Look, in the last Congress, I worked closely with Ranking Member Cassidy on the Tracking Pathogens Act. It enhances our ability to prepare for future pandemics by strengthening efforts to identify new viral threats through genomic sequencing. Thanks to genomic sequencing, the U.S. has been able to identify, survey, and understand emerging variants of COVID-19 and other diseases, but our work really must continue. The Tracking Pathogens Act was signed into law as part of the fiscal year 23 omnibus, but unfortunately, there is no sustained funding for this work. So Dr. Walensky, can you describe why sustained funding for CDC's sequencing efforts, including through the Advanced Molecular Detection Program, is critical to preparing us for future public health emergencies?
Yeah, first of all, thank you, Senator Baldwin, for all of your efforts, your bipartisan efforts in our ability to track pathogens and to track the coronavirus through our genomic sequencing. We were doing at times tens of thousands of sequences a week so we could see, and we continue to do it now biweekly, to see where and what pathogens and subvariants are occurring. It's also the case that we know now that we have this and we can do this, that we have massive capacity to be able to do this for other viral pathogens, for bacterial pathogens, antimicrobial resistance, and fungal pathogens. So we have the capacity here to make great strides. However, again, once we've ramped this up, if we let it run dry, then we will not be taking advantage of all of that capacity. I will also note, I invite all of you to visit your state public health labs. If you go to your state public health labs, and I've been to a lot of them, you will see a really frail public health infrastructure and laboratory infrastructure. Do you have a genomic epidemiologist that can actually do this work? Do you have a sequencer on site that can actually do this work in your labs? And part of the construction authorities that I think the ASPR is talking about is to develop that capacity in your own state lab so that we can not only have the resources to do this genomic sequencing, but then have the places and homegrown people able to do it. Thank you.
Thank you. BARDA has recently begun to explore new types of platform capabilities for emerging threats. I believe that as we work to prepare for the future, we must focus on the development of medical countermeasures for viral families with the greatest pandemic potential. And flexible platforms can rapidly pivot to address previously unknown pandemic threats. That's why I've led the Disease X Act, which would dedicate resources to this particular goal. Ms. O'Connell, how can Congress support BARDA in better prioritizing the development of medical countermeasures against the viral families that present the greatest pandemic potential?
Senator, thank you so much for that question. You know, BARDA is one of the premier research organizations within the federal government, but it's an unsung hero in a lot of ways. It doesn't get a lot of credit. So I'm grateful for a question and an opportunity to talk about them. They have begun to pivot, as you've said, to this platform technology, and we're seeing some of the advantages of that in the mRNA vaccine, where you can just clip one little piece of the virus and switch it out and very quickly ramp back up production. So we're exploring that against a pandemic flu. What would it mean? We've invested $100 million to see what it would mean to transition that technology into a pandemic flu vaccine. So that work is underway. But BARDA has also asked for in FY24 $60 million for threat agnostic countermeasures, which are going, against the broad, we used to be one bug, one drug, and now we're looking at what we can do for multiple drugs against multiple bugs. And that work is underway. We have it in our budget, and we're continuing to look for different applications of the various countermeasures we're currently developing.
Thank you.
Thank you. Senator Cassidy.
I defer to Senator Brown.